Hello. Thank you for your interest in this parent training created by the Mystic Valley Public Health Coalition. You can pause the training at any time. This training series is designed to help parents develop a better understanding of effective communication with their children at every age, setting limits, boundaries, and expectations for behavior, how to intervene early on risky behaviors, and how to nurture protections and healthy decisions. This training will touch on developmentally appropriate prevention strategies and tips for parents to begin the conversations about substance use and your expectations and boundaries before it might be a problem. If you have a teenager in your life, you've probably done your share of worrying about the potential risks out there. You've probably also worried that you're no longer the most influential force in your child's life. But the reality is that what you learn, do, and say to help guide them in making healthy choices is in fact the primary decision-making factor for them. Most of today's teens are thriving, and each year the number of youth drinking, smoking, doing drugs, getting pregnant, or dropping out of school is decreasing. The better informed you are, and the more prepared you are, the more they'll listen. Let's start with what's important to learn. There's a lot of information out there, but we've tried to gather what we think will most empower you as a parent by knowing. First, we will review a snapshot of the most recently collected Massachusetts and regional data. Next, we will talk about myths versus facts, or what society says is truth. Then we'll discuss the primary beliefs that impact a teen's decision to use substances. And last, we will review substance use and the vulnerability of the teenage brain. Before we proceed to review the 2017 substance usage data, I'd like to clarify that when we are talking about drinking, we are generally talking about drinking to the point of intoxication, as this creates a change in the brain. This differs for every child. Additionally, we define binge drinking as 5 or more drinks in 2 hours or less. With drug use, we break it down by drugs commonly abused: marijuana, inhalants, and prescription drugs. A few highlights of the data to note are that current use of alcohol and binge drinking rates are higher regionally than the state average, while e-cigarette and vaping is lower than the state average. There are 3 primary perceptions that impact a teen's decision to experiment and use substances. The first is their perception of social approval, or how many of their peers disapprove of substance use. Reviewing a large-scale nationwide survey of teens in 2017, note the differences between disapproval rates of 10th and 12th graders for alcohol and marijuana specifically, and how it decreases as they age. Next is perceived availability, or how easy it is to obtain substances, as well as opportunities to use them freely. Again, the differences between 10th and 12th grade are fairly large. Last to consider is their perception of risk or harm from using substances. Thinking about the risk of harm from binge drinking, 52% of 10th graders and 46% of 12th graders think that the risk is great or moderate. Similarly, we note that fewer 12th graders perceive a risk or harm in regular marijuana use compared to 10th graders. Social norms are mighty influencers on whether your teen decides to experiment with substances or not. The good news is that social norms that shape healthy behaviors are just as powerful. Combat their misperceptions and beliefs by pointing out the facts: that most their age do not drink or use, that parents and the community do not approve of it, and that most kids actually think it's pretty harmful. Speak up with other parents about your expectations in keeping your children healthy and safe. Chances are that a large percentage of parents will agree and want to set a good example as well. Teens try alcohol or drugs for a variety of reasons: to exert independence, escape from stress, rebellion, and even boredom. But they tend to do so without fully recognizing the negative effects or the health risks. As a parent, you hold tremendous influence over whether your child decides to use or not, which means that it's important you are well informed and are not sending mixed messages about the dangers of alcohol and drug use. Our culture likes to dismiss teen substance use as innocent experimenting, but research indicates otherwise. 90% of addictions begin during the teen years, while the brain is still in critical development. Furthermore, studies show that beginning to drink before the age of 15 puts a teen at 40% higher risk of developing alcoholism later in life. Another prevailing belief is that your teen will be safer if they are in yours or a friend's home when they drink. Here's the truth. If you are trying to protect them by doing so, research shows quite the opposite. Teens who have permission to drink at home, or parents who provide them with alcohol, report higher rates of binge drinking and show the most increased use from ages 16 to 20 years old. Additionally, by giving them permission to drink, you are saying to your child, "It's okay that you break the law, as long as you do it with me." By allowing underage drinkers to drink in your home, you are liable, and it does not guarantee safety. The last societal belief is about the safety of marijuana use for teens. Some people may think that with the legalization of adult use of marijuana in Massachusetts, it must not be a big deal if their teen smokes occasionally. This could not be farther from the truth. New research on regular marijuana use before the age of 18 shows a connection with deficits in attention, visual search, executive functioning, and overall IQ. Furthermore, persistent marijuana use across 9th to 12th grades is connected to a lower GPA, lower SAT scores, and much higher rates of mental health symptoms. Some of the most critical information you should understand when talking to your kids about the risks of substance use has to do with the developing brain. It turns out that the young adult brain is still developing well into their mid-20s. The areas under the most construction are the frontal lobe and the hippocampus, basically the brain's seat of executive functioning and executive decision-making. Damage from repeated substance use can result in depression, problems with impulse control, and with overall developmental functioning. There are several areas of the brain, as the visual shows, that are affected by alcohol use, but the two major points of the brain that are affected most are their short-term memory and ability to learn new information. An adolescent brain produces 5 times more dopamine in response to intoxication than an adult brain. Increased dopamine production in response to a chemical is what leads to eventual dependency and addiction. The degree of neurological negative consequences a teen may develop as a result of alcohol and drug use really comes down to their own individual genetic and psychological factors, the amounts they've consumed and how often, as well as the age of initial intoxication. No matter what you believe about teen alcohol and drug use and what they perceive are the risks, it's hard to refute science. Use the information you've gained to frame conversations with your teen. Help them to understand that there are real consequences and that delaying use as long as possible is supported by real science. So now that you are armed with education, let's talk about what you can do to ensure your kids make healthy decisions and stay safe. Do develop a consistent style of parenting that communicates warmth and reciprocity, but also conveys the expectation to follow your rules and the consequences if they are not followed. In a large study looking at which parenting style is more protective against adolescent substance use, the authoritative style, defined by a high level of rules and a high level of communication, was the most protective. Parent networks and peers within your community are valuable resources, when it comes to keeping kids safe and healthy. Stay informed about trends. Meet with other parents, neighbors, and adults in your teen's life. Know that you are not alone and that the majority of parents do not allow their teens to drink, and all parents want to keep children safe from harm. Lastly, clarify your beliefs and values. Ask yourself, what are your own values and practices about alcohol and drugs? If it is to teach your teen about responsible drinking, then what might that look like? If your expectation is no substance use, explain why. What's important is to develop a shared set of expectations based on a shared set of beliefs. Talking to your child at an early age about drinking is the first step toward keeping them alcohol-free. But as they enter junior high and high school, the pressure to try alcohol increases. It's important to continue the conversation throughout adolescence. The goal is to have short and frequent discussions, as lots of little talks are more effective than one big talk. Try using everyday opportunities to talk, in the car, during dinner, or while you and your teen are shopping. Talking to teens before a situation occurs has the greatest effect on their decisions. Take the time to be specific and talk about your beliefs and opinions regarding alcohol. The more specific you are, the less chance for a gray area, as teens love to point out inconsistencies and find any loophole. Know that if you do not talk about it, you are still saying something. What you say to your teen about alcohol is up to you. But remember, parents who do not discourage underage drinking may have an indirect influence on their child's alcohol use. Always make it a point to clarify your expectations and rules to show that you disapprove of underage drinking. Some parents worry that doing this with kids who've been good may create defensiveness, that establishing consequences for actions they've never taken yet is not fair. So keep the tone matter of fact, with the emphasis on showing that you care about your child's happiness and well-being. Build your child's skills and strategies for avoiding underage drinking and drug use. Even if your child doesn't want to drink or use, peer pressure is a powerful thing. To prepare your child to resist peer pressure, you'll need to build skills and practice them. Role play a few scenarios. Give them scripts for excuses they can use. Lastly, decide if you want to establish a no questions asked agreement so you can help remove them from an uncomfortable or unsafe situation. While this means no questions asked in that moment, don't miss this opportunity to have a follow-up discussion about their decision-making, perhaps the next day. You might be concerned about your child's current drinking or drug use behaviors and be wondering whether it indicates a problem or normal growing pains. Experts believe that a substance abuse problem is more likely if you notice several of the following signs at the same time, if they occur suddenly, or if some of them are extreme in nature. Things like mood changes, school problems, rebellion against family rules, perhaps a recent switch in friends, or reluctance for you to get to know their new friends, a sloppy appearance, or lack of interest in things they formerly liked, and a general low energy. Other obvious signs are finding substances in your child's room or backpack, and physical or mental health problems like poor concentration or lack of coordination. If you are truly concerned about your child, understand that the important thing is to act now to find the best available services to help your child begin building a substance-free future. One resource could be your child's school. In 2016, Massachusetts legislation mandated all public schools to participate in SBIRT, or Screening, Brief Intervention, and Referral to Treatment, for 2 grades. It can be really confusing and overwhelming with all the types of treatment options and programming offered. So a good place to start is with a pediatrician, school social worker or counselor, or local youth services. Another option is to access help from the Massachusetts Substance Abuse Helpline at 1-800-327-5050. Here are some helpful resources and online tools for parents. Visit our website for more information about what we covered today and to view our other parent trainings. You can also download and print these slides anytime. Thank you for taking the time to learn more about promoting healthy decision-making and behaviors in our children. We hope that you find this information useful, and we encourage you to check out our website for more information.